Good afternoon, everybody.
Good afternoon, Carol.
You look comfortable, Ronnie.
I'm at home. I'm comfortable. I've been working from home a lot lately, so
Yeah.
it's been a good thing.
Thank you, Madeline, for agreeing to chair the meeting today.
You're very welcome. Glad to. So I'm wondering, do we have a quorum at this time?
Let's see.
Not quite yet. We still need 2 more board members to join us. I count 1, 2, 3, 4, 5, 6, 7.
That's what I count to, Chelsea. And Luann said that she was going to be a little late.
And I know Eric is not going to make it, nor Brian, nor Sandra. So hopefully, and I know Kat, did I say Kat? I don't think Kat's going to make it either. So hopefully Dana or Julie sign on.
Well, Julie said yesterday she would be here.
I know they're not coming. Oops, I need to do that. Oh, no. There we go. Bear with me.
Welcome back, Kendra.
Thank you. Hello.
Where's the baby?
I can have him be brought in. He's
Well,
with my husband. My husband's off right now. He's in there in the other room.
okay, well, I got to have my baby fix, you know. So.
All right. I'll get him to make an appearance.
Martine joined the staff meeting on Monday and we got to see Camilla. So that was really fun.
Congratulations.
And you heard that Jenna had her baby.
I did not. Oh, that's awesome. Oh,
Of that little lady. Nice.
We just need to have a meeting with all the new babies.
kind of
Not to
fun.
be politically incorrect, but there seems to be a lot of baby making going on.
I wonder what COVID is going to do to the statistics for babies.
Yes, mine was pre-COVID pregnancy. So.
There's
Jenny.
Oh, cute.
But mine's in real life, so I'll try to get.
Yours is what?
Mine's like right around the corner. So.
Okay.
Hi, this is Kate Mendel from Coordinated Care. I don't know if folks saw Kat from AmeriGroup's email this morning. She's unable to attend, and so I'll be the board rep for 2021 for the MCOs, so I was asked to step in a little early today. So thank you for having me.
Welcome.
Welcome, Kate. It's good to see you face.
Well, if Julie joins us, then we would have a quorum if we are going to allow Caitlin to
Here he is.
step in. Oh, there he is. Oh,
Oh,
It's Felix. Oh, he doesn't like it.
I'm sorry.
oh. Well, I'm just wondering about going ahead and moving forward And then when we get the action items, we can see if we have a quorum at that time.
That sounds good, Ellen.
So I would like to welcome everyone and thank you for taking time. I know everyone has a pretty busy schedule, and I will have Chelsea go ahead and just do the roll call for us.
You bet. You know, maybe I'll go start back up here. Maybe we could start with the board members. So we have Madeline Carlson with us.
And I'm with People for People, representing transportation.
Rhonda Hoff.
Afternoon, everybody. Rhonda Hoff, Yakima Neighborhood Health Services, representing housing.
Dan Ferguson.
Yeah, Dan Ferguson with the Allied Health Center of Excellence hosted at Yakima Valley College, representing workforce development.
Kendra.
Kendra Palmers, representing community and faith-based organizations from Catholic Charities.
And Felix. No, I'm just kidding.
He's mad.
Filmmaker. What? Oh, I think you're on mute, Les. I'm sorry. I see the lips moving.
Well, they say, you know, if you hold the space bar, it's supposed to go. So I was trying the space bar thing. Didn't work. I'm Les Stolniker, ESD 123, School Health Services, Education. I have a 1 o'clock meeting I have to get started, so I'm going to slip out for about 4 minutes there and get it going around 1, and then I'll be back. Sorry about the inconvenience or the interruption.
Thank you.
Thank you. Martha.
Martha Landman, Columbia County Public Health and Garfield County Health District, representing public health.
Ronnie.
Ronnie Batchelor, Lord's Health Network, representing the consumer.
Great. And then we also have Kate Mundell, even though she just introduced herself, but she will be stepping in on behalf of the managed care organizations, it looks like, for today. All right, so I'll switch over to Greater Columbia. So there's myself, Chelsea, I'm the administrative assistant. We have Carol with us.
Carol Moser, Greater Columbia CH.
I saw Wes on the line, I think.
Can you all hear me?
Yes.
I'm here.
Fabulous. We have Becky Combs.
Good afternoon, everybody. This is Becky.
We have Sam.
Good afternoon, Sam.
I see Lauren.
Hello, everyone. Lauren.
I see Laurel.
Good afternoon. Hi, this is Laurel.
I see we have Diane.
This is Diane Halo. I'm here.
I see Greater Columbia ACH, but I have a feeling that's Brisa.
Good afternoon, everyone. Yes, this is Brisa.
Hi, Brisa. And then I believe that's all we have from Greater Columbia. Did I miss anybody? Okay, so then other joiners we have Joel Chavez.
Good afternoon, Joel Chavez with CHPW.
Joel, and then we have Victoria.
Hello, Victoria Bryan with Ideal Option.
Penny Bell.
Hi, this is Penny with Ideal Balance.
Great, and if I did not call your name, please do so now. Oh, please, Madam, yours.
It looks like Martha's on, but I don't know if she has a microphone.
He already went, I think.
Thank you. As in reviewing our attestation of conflict of interest and also noting the self-dealing transactions prohibition in standard for approval. Please, again, review our commitment towards those. And we will then move into the consent calendar. And that is the October 2020 meeting minutes. And I will entertain a motion to approve.
This is Rhonda. I'd move to approve the minutes.
Second.
Second.
Thank you, Rhonda. Thank you, Les. And is there any discussion? If none, all those in favor signify by saying aye.
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 And all those opposed, same sign. I too vote aye. Motion is approved.
Hey, Madeline, if we don't have a quorum, is this truly something we can do? I should have thought of that earlier.
No, thank you. We are.
Luann, just
go ahead.
I was just letting you know that Luann just came on, so you should have a quorum now.
Awesome. Thank you, Luann. Awesome. You just made it in time. All right. So we will then move into the GCACH report and updates by staff. So Carol, do you want to lead us with that?
Sure. And as per usual, as the newsletter articles come up, I will just have all of the staff who wrote them give the report. Thank you. So the first one would be Wes.
Sorry, I had my mute on. Can you still all hear me?
Yes.
Yes.
So we've established a relationship with the analyst at Pasco Fire Department who is helping staff the community test site that's based on Argent in Pasco. And up until the end of October, he had been providing us with some data, part of which you can see right here. The bottom graph looks at daily case counts, and I have the week that goes beyond that peaks out at about 500 plus cases, 533 cases. However, this is pretty much out of date right now. As you might know, if you've been following what's been going on in the news in terms of how busy test sites everywhere are, there's been several news stories about how what's called CBC West has had a queue of cars extending out onto Argent waiting to get tested. Normally people pass through that site quite quickly, and they've reported cases as high as 700 cases per day or higher. Originally, the test site was supposed to have a maximum capacity of 500 cases per day. So they've certainly met that benchmark. To help meet this excess capacity, they've actually expanded their days from 5 days a week now, I believe, to 7 days a week. So in that top graph, one thing I do want to point out is that you'll see that little orange bubble that's a little hard to read. But they've also been doing mobile testing where they've gone out to sites. And again, with the most recent data, I only have one incident where they were able to go to offsite to do testing. So that's actually all I have for this part of the report. And this actually covers the next action item on the agenda as well. Does anybody have any questions about this?
So Wes, just a clarification, it's not so when you say cases, those are people who are being tested, not positive, of course. It's just those showing up for testing.
That's correct, Dan. Thank you for clarifying that. When I said cases, I meant clients, individual clients, regardless of their test outcome in terms of positive or negative.
Yeah, thank you for that clarification.
This is Martha. What's the turnaround on the test, Wes?
Again, previously, the last that I heard is that they were being turned around, I think, in 1 or 2 days. I heard in one incident was actually less than a day, depending on how quickly the test can get to Seattle, because they're being processed by the University of Washington Medical Laboratories. But that laboratory there has proven to be very, very reliable in getting test results out quickly. So Carol may know more about this, but I think that the turnaround is somewhere between 24 and 48 hours, which is really ideal and suitable for potential subsequent contact tracing.
This is Lauren. I just wanted to add to that. In this article, we say the test site is open Thursday through Monday, 8:30 to 4, and it's now open every single day, 7 days a week.
Thank you.
So the next article is just a little bit more about the Medicaid transformation year 6. The Healthcare Authority has applied to CMS to extend the Medicaid transformation program for a 6th year. Part of the reason is because of COVID. COVID has really disrupted the ability of providers to report and for the ACHs to do the work that has been promised to CMS. So the process is that the Healthcare Authority has prepared a package for the state legislature that will have to approve the year 6. They're not asking for any new funding. There was approximately $138 million that was still left on the table that would be used for year 6. So we're hoping that we get the extension, and we will know mid-year, probably around June, whether or not CMS approves of the MTP year 6 or not. Any questions?
That's great news. Thank you, Carol.
It looks like from a preliminary analysis that the way that the ACHs would share the wealth would be primarily through the same formula that we have that we've had from the very beginning, which is based on Medicaid population. So it would mean a significant amount of additional funding for year 6, and it would all be based on pay for reporting, since we would not have enough time in the program to do pay for performance, which is quite a lag, about 1.5 years. It's all pay for reporting. Sorry about that. The next article is a little bit about the Learning Symposium. Every year, the Healthcare Authority is required by CMS to hold these learning symposiums, which invite our providers and all of our organizations, and especially our staff of the ACHs, to share information that we've all learned from the past year. This year's Learning Symposium, the 2020 Learning Symposium, was entirely orchestrated and organized through the ACHs, and we relied heavily on our consulting organization, Artemis, to help deliver the symposium. So it was a 3-day event, about 8:30 to 9 o'clock every day, Monday through Wednesday. And we had about 3 panels per day. All of the ACHs participated in facilitating a provider or a panel, and I got to do the social determinants of health. We also had some representatives from GCACH, including Bridget Beachy from Community Health of Central Washington, and Kathy Saluskin from the Yakima Nation, who participated in the Tribal Partnerships panel. And there's the link to the Learning Symposium in case you want to hear some inspiring conversation and talk from John Powell and Nicole Marr. Thought that they gave excellent presentations and are well worth listening to them again.
Thank you.
So this is an article about the COPCOM Care Resiliency Campaign. We are going full force with this. We know that Dr. Mosseth had presented to the board at the last meeting, and so I'll be talking later on in the board meeting today about the media consultant and hiring a media consultant. So I'll just leave it at that.
Thank you.
Hi, this is Laurel. This article is in regards to one of our cohort 3 practice transformation sites, Richland Rehabilitation. And it's been just a joy to work with them as they've quickly progressed in their practice transformation efforts. One of the stories that has been shared with me from Holly Kaiser, their senior administrator, was their ability to identify a need for a van. Transportation was needed for helping patients when they were being transferred to the facility from the hospital or to the hospital from the facility. And so they have purchased a van using funds that they've earned from their practice transformation efforts and meeting milestones. So here in just a moment, you'll see a picture of the van and the staff. They've also have participated with GCACH when we asked about things that were needed in regards to COVID. So being able to provide remote access or virtual access to their patients for appointments. So they were able to use some funds to purchase some iPads and Chromebooks for their patients to use. They are using those for the remote visits and have really appreciated having that, and also are able to use that to help with the their patients that are away from their families during the COVID restrictions, so that they can Zoom and FaceTime with their families. So it's just a joy to work with Richland Rehab and to have them show us the benefits of some of their efforts in working with us in practice transformation.
So this is a brief article that talks about the Yakima COVID-19 test site that opened up on October 22nd, or excuse me, 27th at the end of October. The statewide partners that helped set this up, including Department of Health, the Health Commons Project, and University of Washington Medical Laboratories, are the same between here, are the same as here in the Tri-Cities. The hours there are a little bit different. The community partner there, the primary partner there, as here, is the Yakima County Health District. Other partners also include Virginia Mason Memorial, which is now, I believe, Yakima Valley Memorial Hospital, Signal Health, State Fair Park, and the other partners as I talked about. So the Yakima County Health District has stated that their community-wide testing goal is going to be 1,500 individuals per day, including those from this test site. I'm not quite sure where they're at with those numbers, as we don't have access to that information, but this is the latest that we have on that test site.
Thank you.
This is neat. So as you see, we have canceled the 2020 Provider Recognition Awards, although we all need to party or need a party during these times. Unfortunately, this was a difficult decision, but we value the health and safety of our providers, our partners, employees, and especially with the ambiguity of the pandemic, we felt this was the best decision for the award ceremony this year. But we do plan on making up for it next year, so stay tuned. It should be an over-the-top gala. I'm probably overemphasizing it, but stay tuned. It should be 2021. It's gonna be rocking.
That sounds great. Thank you.
And last but certainly not least, we would like to introduce Brisa Perez as our new Community and Tribal Engagement Specialist. This is her 3rd week now. Brisa, would you like to tell the Board of Directors a little bit about your background that you shared with us?
So hello everyone, like Lauren mentioned, this is my 3rd week getting started with GCACH. A little bit about me, I've met with a few of you, I believe already, and have more meetings coming up. But a little bit about myself, I was born and raised over in Walla Walla. Just graduated from WSU about 2 years ago. Coming up this May. Studied political science. Over the last year, I worked with the Census Bureau doing a lot of work over here in Eastern Washington, doing a lot of workshops, getting those numbers up, encouraging folks to register and complete their census. And now I'm with Greater Columbia, getting to know everything that the organization does, every partner, every local health improvement network. So like Lauren mentioned, this is my 3rd week, getting to know everything still, and hope to meet the rest of you in the next weeks.
Thank you, Brisa. Yeah, we have been meeting the past 2 weeks with local health improvement network leaders and TPAs as well. So thanks, Brisa.
Welcome. And Diane, do you want to provide additional information for the Learning Collaborative schedule?
For this one, Dr. Janice is going to be the speaker for this and for December. And we have developed a 2021 calendar that we'll be sharing with you guys next month. So we do have them planned out for next year as well.
I'm sorry, did you say who the speaker was for next month?
Dr. Janice, Maxine Janice. Is that correct, Carol? Is that how you say her name? Okay.
Yes, Dr. Maxine Jennings from, she's now the Public Health Officer for the Yakima Nation, but also works for Heritage University.
Right, thank you. And Wes, did you have additional COVID-19 community test site measures to share?
Madeline, I do not at this time.
Okay, thank you. So we'll go ahead and move into the action items. And so first up is the October 2020 financial reports. Becky?
Chelsea, did you see if Julie had joined or not?
I do not see Julie on the line.
Oh. Okay.
So I'll ping Julie just to make sure, Becky, but maybe we could go through some of the other items because Julie, as the chairman of the finance committee, usually makes the recommendations and provides a report. Unless Rhonda, you were at the finance committee meeting yesterday.
I was.
What would you like to do, Rhonda?
Well, I would suggest that we have Becky do the report and I'll make the recommendation because we were in agreement yesterday.
Okay, thank you.
Thank you, Rhonda. So, and just to bring you all up to speed, we didn't have a quorum at the finance committee yesterday, so we had discussed that Julie was going to present these and recommend them to you guys. But unfortunately, it seems like she's had something come up, so I'll go through them and then we'll let Rhonda lead the rest of that part. And then also, just so you all know, we did have a question on one of the financial reports from one of our board members that we still have not been able to answer before the board meeting today. So we'll go through that too. And maybe if that person wants to ask their question, they can. If they don't, that's fine too. So Chelsea, go ahead and pull up the report, please.
Did you want this report or would you like the statement of activity first?
No, the first one. Okay. Thank you. So, and actually, if you can go to the, we normally just go through the budget versus actuals, unless there's any questions. If you guys had a chance to read through this that you have, if you'd like to bring them forward. Okay.
You know, I have a question. Can I just ask it since it's on page 3? If you go up to the top of page 3. There it is. 15,000 and 4,000 do not equal 23,000. That's the question I had. And when I looked on the other form, I found an answer, but it doesn't show it on here.
Right. So Sue Lamita and I have been trying to run that report again to see what has happening. Like maybe there's something hiding in there that isn't coming out on the report. We weren't sure. And as of the board meeting, we hadn't resolved that yet.
Okay.
So I just wanted you to know that.
Yeah, on the SOA the other document, it has a restricted fund, the exact amount at the very top. That's why anyway. What I noticed was that the totals were the same, but the items were different, and that's why I asked. So.
Right. So we will get an answer to that question for you.
All right. Thank you. Otherwise, it looked really good, by the way.
No, thank you. I appreciate you looking at that. I feel like that not a lot of attention gets brought to the financials, so I appreciate you looking at that.
The MCOs reviewed as well. We actually read through it too. And the only thing that we saw as a group was that it looked like there was an overpayment error, and just wanted to make sure that protections were in place that it didn't happen again. Just knowing that there wasn't a finance meeting prior to the board meeting.
Mm-hmm. We did have a finance meeting. There was just 2 in attendance, and so those 2 did get the full meal deal. But thank you for that. And yes, of course, there are some steps being taken to ensure that doesn't happen again.
Great, thank you.
So, Chelsea, you want to go back to the budget versus actuals real quick? We'll just, mostly because we're getting to the end of the year, just wanted to show you guys how we're doing with our budget. If you keep scrolling, Chelsea, down to the expenses. So you guys can see we're doing really good, mostly because of COVID, we're not spending like we wanted to, or as we had planned for this year. So we have a lot of money left over in our budget, and later on we're going to go through our proposed budget for 2021 for operations and DISRIP. And it's just a first read, so we're hoping for some good feedback from you guys. And again, we did present that to the Finance Committee also, and the DISRIP budget. Oh, there's Julie, yay! The DISRIP budget also has been reviewed and approved by the Budget and Funds Flow Committee. So I appreciate your guys' questions. Is there any other questions?
So Becky, it might be useful just to go through the main categories to show where we're, close to budget or way under budget. If you had any highlights that you mentioned yesterday.
The highlights I mentioned yesterday on this budget versus actuals.
Yeah.
I honestly don't remember what I mentioned, Carol. I'm sorry. Do you want to help me out?
Well, I think that, when you look at the actual columns versus the budgeted items, obviously we're pretty close in most of the areas. You can see sponsorships and community events. We didn't spend as much as we thought we were going to, so we were under budget by about 17 million. Our payroll expenses, we're going to be very close. I don't know why there's not an actual in that column, but we're very close to meeting 100% of our projected expenses for payroll. Professional services, I think, is another kind of highlight that we were under budget this year for some of our professional expenses. Again, due to the fact that we didn't have as many needs perhaps as we thought that we were going to, but that will be corrected next year. Facilities, spent a little bit more in rent. That was due to having the 2 leases and getting out of our lease early from CAC. Operationally, we were pretty significantly under budget, mainly from the fact that we didn't expend, like Becky was saying, you know, a lot of the funding for office supplies and subscriptions were lower. You can move forward. The staff travel was significantly impacted by COVID because we weren't able to travel. We have bumped that up. Well, we're hoping that we get to travel in 2021. And then some of these pass-through funds were funds that we brought into our account that we have fully expended, such as the internships. We do have a significant amount that we'll be carrying over into our learning collaboratives next year, as well as the funding from the summit convening. And that was the opioid summit that we had actually received some grant funding for. So we got compensated for some of that funding, so it didn't cost us quite as much. So in the end, it looks like we're spending about $1.79 million out of a $2.1 million budget, and it sets us up to be in really good shape for 2021.
Thank you, Carol.
Are
So
there-
Julie, we were just mentioning about the finance committee and that you were going to bring these forward to the board for us since we didn't have a quorum.
Yeah, so we had a couple of action. I apologize for being late. We just concluded a call about the COVID vaccine, so I wanted to hang around until the end there. What we'd like to do, we did not have a quorum yesterday, so we would like to advance for approval the current financial statements, which is what you're looking at here. And I would move those be approved, but we're looking for a second.
Julie?
And this is Rhonda. I'll second.
Okay. Anybody have any questions on these or?
Well, this is Rhonda. You know, Caitlin asked earlier, I think it was Caitlin, and I just wanted to comment about the overpayment. We actually did spend quite a bit of time yesterday talking about that and the mitigation on the plan to make sure that that doesn't happen again. And so recognize that we did spend some time looking at that. So I don't know if that's separate on the agenda today or not, Becky, but you might want to, is that an additional item or is that something that you're going to address here today?
It is on the agenda, yeah. It's this
Okay.
SR right here.
Thank you. I just wanted to acknowledge that we did spend a fair amount of time talking about that yesterday.
Yeah. So we have a motion and a second, I think, on the financials. Did we get them approved for the month?
So all those in favor of approving the financial report, say aye.
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 All those opposed, same sign.
Okay.
So, I too vote aye, motion carries. Thank you.
Okay, Becky, do you want to talk about the overpayment? Do you want me to take this or?
Yeah, Carol, I thought, were you going to talk about this or did you want me to?
No, I'd be happy to.
Great, thanks.
So the situation background assessment and recommendation report for Kate, that's what we call the SBAR, is really a briefing that's used by clinical providers to assess the situation and get a good understanding of what needs to happen. So we've been using the SBAR format for the board of directors to make for all of our action items. And basically, if you could go back up to the top, Chelsea, what happened in September was when we inputted the payments to the providers, we actually duplicated the same payment that we made on September 15th on October 13th. So since that time, we have gone back and reviewed all of the payments to the providers numerous times. We've had numerous checks and balances. We're working with a consultant named Dan Vizzini out of OHSU to reconcile those payments. Fortunately, by quarter 3 for cohorts 1 and 3, and by quarter 2 for cohort 2, because they're all on different cycles, this will pretty much even out. So we've done a complete audit of the payments, and we conclude that really by the end of quarter 3, most of those payments will be balanced by the end of the year.
So yeah, I would just jump in because I think genetically I'm more Chief Financial Officer than Chief Executive Officer. And back when this was identified, I think I got a call within about an hour of Becky and Carol finding this error, and we had a plan in place. They were able to identify exactly who had received those overpayments. And I think by the end of the following day, they identified that they would be able, by treating them as credits, to recoup those funds. So it was unfortunate, errors do happen, but at the end of the day, I think we were able to jump in and really mitigate those issues. And more importantly, really sort of identify how we're going to make sure it doesn't happen again. So, and I just think with some turnover that we've had, but people were really scrambling to get all their work done. But since then, I think they've done a fabulous job of identifying some additional resources, including resources that have experience working with ACHs. Because I will tell you, the accounting associated with ACHs is very complicated. It includes deferred revenue, custodial cash. It's very complicated stuff. So it's good now to have a CPA firm and a review and audit firm that has experience with ACH. But I'm happy to answer any questions.
When you're saying third quarter, is it third quarter calendar year or third quarter fiscal year? What is the third quarter?
That's a great question, Madeline. So we currently have three cohorts that are on a calendar year. So cohort 1 starts in January. Cohort 3 starts in January. Cohort 2, which is our behavioral health providers, actually they have a fiscal year that goes from July to June. So their first quarter is really the third quarter for cohort 1. So it makes it a little bit more complicated to keep track. And that would be the discrepancy in any of the payments might come in cohort 2 because they're on a different calendar year. But as we said, by the end of the year, we should have all of the credits accounted for and paid for. And then there will be a small number of organizations that will have to carry forward some credits into 2021.
Thank you. Right. So do you need a motion for this, or is this just information?
No, I think we just wanted to make sure because in my world, $1.7 million is real money. And we wanted to be very transparent with the board about this transaction and again about the corrective action that was taken in response. So no action is required.
Actually, Julie, at the very bottom, what we would like for the board to do, though, is to authorize these payments as kind of the new baseline. So the Schedule 4 shows the adjustments to correct quarter 2 errors. If you could go up, please, Chelsea. There's a schedule of all the provider organizations and how much is owed to Greater Columbia ACH, and we would like for that to be established as the new baseline. And then as we proceed into quarter 3, any credits or any incentive payments that need to be made would be charged against these credits. So we just wanted to make sure that we had a baseline that was approved by the board of directors along with that methodology so that we can start making quarter 3 payments.
Could someone check the chat box? I posted a question.
How much will be carried forward into 2021? That's a good question, Loanne. I wish I could have a specific answer to that. We have not done Q3 payments yet, so I don't know the answer to that. I think it's going to be fairly, it should be pretty much on target depending on how much the provider earns. So let's say, for example, Barth Clinic, who is right now has a credit of $55,000. If they earn that by the end of the year, they would carry forward zero amount into 2021. Unfortunately, it's not quite as easy as that because for Q4, those payments don't come until February of 2021. So we're always lagging in payments, but we can try to figure that out and give you as good an estimate as we can to that question.
So do the financial statements, then the balance sheet reflects this as an accounts receivable?
It will when we get together with the accountant. After we get this all approved, we'd like to take all of this to the accountant to make sure that we have those receivable numbers correctly.
So, Julie, did you want to make the motion to authorize the adjustments as shown in Schedule 4, adjustments to correct 2020 Q2 errors as the new baseline for provider incentive payments?
That I would move.
Thank you. And a second?
This is Rhonda, I'll second.
Thank you, Rhonda. It's been moved and seconded. All those in favor signify by saying aye.
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 All those opposed, same sign. I too vote aye. Motion carries. Thank you. And next up is the Cope Care Calm Resilience campaign. Diane?
Okay, so for the Cope Calm Care campaign, so we've kind of already discussed the background and the situation with the board already, and so it just talks about how that we're in this dissolution stage right now, and that the next 3 to 6 months are going to have a lot of behavioral health issues. So we wanted to address this. This SBAR is actually for us to hire a media consultant to help us develop a message forward as we go. And so the media consultant would work with the GCACH staff and the behavioral health consultant, which is Dr. Mosseth, as well as the Community Resilience Committee, which involves the original people that were on the original committee plus behavioral health providers. We have established that the target audiences are ages 5 through 12, ages 13 to 18, and then adults over 18. So this provider will produce a toolkit targeted to those 3 audiences, and that they will also help develop and portray the messaging for the skilled model for Cope Calm Care and resources with materials to include that. And then they're also going to develop a campaign, a media mix throughout the whole 9-county region, as well as a website that will be included into our original GCACH tab. So the background, what is the Cope Calm Care skill set which is the COPE is the thinking skills, the COM is the doing skills, and the CARE is the being skills. And so this is what we're going to be framing the message around. And so if you go down just a little bit further, Chelsea, that's just the graph originally that we showed. We did some analysis, and then this was actually provided to us by Dr. Malseth. And so these are just ways that, these are common responses for disaster. And so this is what the message is going to be developed from, are these tools that we've been received through Dr. Malseth. So we had 5 RFPs that came in, and we had them scored by the GCACH staff as well as the communications committee. We established that a $500,000 campaign is what we have in the budget for. We have all researched the RFPs that had came in, and the Phil group had the most comprehensive RFP. They had a very detailed budget on how they would spend the money. They provided how they would create a tool box for each of the target audiences to include worksheets, some screening things, some for the smaller age group, a workbook that includes stickers and things like that, just to kind of make it fun for them, as well as for the others. For the team, they had some different areas that they would post on in their social media and other ways. The only thing that we are going, when we do talk to Phil Group about doing their being the marketing consultant for us, they had a real extensive media budget that actually was $408,000 or $408,000 that is dedicated to the media specifically. And we discussed that that we would offer it to Phil Group with a contingency that they reduced it by $100,000, bringing the total for the media consultant being $400K, which leaves us with $100K for training purposes for the schools, because we also have determined that there's going to need some kind of training for these it to be successful, and that we have our behavioral health providers that are willing to help go into the schools and train with this materials, and then I think that will actually help us because the materials, they're not exactly like self-serve. Maybe for the adults they are, but for the children, it's going to take a little bit of education and training. And so we decided that a training, then by webinar and other ways, that would be the best method going forward. So what we're asking today is that the board approve Field Group as the marketing media consultant for us. And so that's what we're asking for.
And a total budget of $500,000.
Yes, and the total budget of $500,000.
Joanne?
Yes, help me better understand the involvement with ESD 123 in the school districts up to this point.
So we have reached out. We have had a few contacts through the different ESDs. they are willing to help us get into the schools. We are actually doing have reached out to Catholic Charities. Chris, they're in the process of taking it to the CEO for the school district through the Catholic Charities, and they're going to be our pilot program, and he is going to put it through them, but using the materials we already have, and just kind of so that we wanted to kind of have some information out there about this program before we, hit the media. That way we know, that it's working and that the schools through the Catholic Charity system are able to utilize the materials the way that we intend them to be utilized. And then we're in the process of, I've reached out, I did some research. There are 58 school districts in the GCACH region. There are 288 schools with a total of over 300,000 students. So, I mean, that's a very big chunk to bite off, to be honest, and so having multiple behavioral health providers be able to help us, distribute and train the teachers and those individuals that will be working with with students, the school counselors, and such. And so that's our plan going forward. We then also want to distribute the materials to all of our partners, as well as our primary care and hospital, and get the information as well. That's the second phase approach. And then the third phase is getting it through the community, doing, through United Way, through all the community organizations, the Tri-Cities Community, Tri-Cities Chamber of Commerce, and all the other Chamber of Commerce, and also some of the city managers, and that would be phase 3. So that's kind of where we're at, where we have a different steps for the phases. And so we're hoping but we really need to hire the media consultant to get on this, because it's going to take, at least a month to a month and a half to develop this content and so we want to get this out as soon as possible. We're hoping to try to shoot for January. I know that's a big, ambitious goal, but we're going to try our best. And so that's why we're bringing it to you guys today, so we can get the media consultant on board as soon as possible, so we can get working on the material.
Well, I think with that kind of reach with the school districts, that's a big lift. And so particularly when school districts are just trying to keep their teachers and staff, quote unquote, alive during all of this flex. And so understanding, their willingness to provide training opportunities, how it fits into their already existing training opportunities, is going to take some real relationship development. But the good news is that all the districts have been tasked with specific social emotional learning goals for every grade. So that's on the good news side. And the bad news side is this is one more thing that's noise when they're in the survival mode. So really applaud you for doing this work.
So Loanne, I can say that Diane's been working with Adona Taharaj. I don't know if I'm pronouncing her name correctly, from ESD 123. She was absolutely thrilled to get this information because they are looking for substantive evidence-based tools that will help the teachers identify issues in the kids, materials that will help the teachers themselves survive during this period. But ESD 123 is all on board. They attended our first training that we had with our behavioral health providers. And so we hope to have that similar relationship with ESD 105 and the ESD that covers Whitman County. So, but you're absolutely right. This is one more thing that they have to be concerned about. According to Krista Villeneuve, though, this is exactly the kind of information that they were hoping to get. So they're very excited to be able to share information.
Yeah, the thing that Chris had said was that Tim and the physicians there, their psychologists, were already in the process of developing something that would be useful for the school districts and everything. But then what was missing was the disaster piece part of it. And so that, I think, is what he was so excited, is that it's combining that, you know, what they've already have, the knowledge that they have as behavioral health provider, and put in with the disaster training. And so the combination is what they're really excited about.
I move to accept the recommendation as presented.
Is there a second?
I
This
second.
is Bonnie. I'll second.
Okay, I wasn't sure who got the second, but Chelsea, can you figure it out?
I definitely heard a Kendra in there, so I think.
Yeah, I seconded. You can take me if you want.
Okay, thank you.
Okay, thank you, Loan.
Part of this, right?
All right, is there any further discussion? And I just wanted to, again, kind of point out that the budget for field group is going to be like 400,000, and it won't be the full 500,000 because you're going to be negotiating that to have 100,000 for the training. Is that correct? Okay.
Yes.
I just wanted to make sure that that's understood.
And that was the recommendation from from our meeting that we had yesterday with the communications committee, which you guys knew that in their proposal they had a very extensive media, and I think that we can taper that back to fit the needs that we need to have, as well as Carol and I were also talking about that there's some other costs in the other areas for like shipping that we may not need, because if we're having somebody going out, going to provide those trainings, we might not have to ship those materials. So there are room for some changes with, but yeah, that will definitely be field group offer would be that, it would be a contract contingent on that they can lower their budget to 400,000.
And Madeline, I think you raised a good point, because what I don't want to happen is if for some reason field group does not want this contract based on the fact that they might not be making as much money as what they had proposed, we would go to the next bidder that scored the second highest. So I'm wondering if we should also recommend that if field group declines the contract, that we would go to the next highest scored vendor. I don't want to have to come back next month because we forgot to include that in the motion.
This is Loan. I'll amend the motion to approve up to $500,000 for the campaign for the COPE, Calm, and CARES skills model implementation. And that allows you to work with specific bidders, whether it is field group or the next one.
Great.
Does the second concur?
Kendra?
Yes. Yep.
All right. Thank you so much. Is there any further discussion? Hearing none, all those in favor signify by saying aye.
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 All those opposed, same sign. I too vote aye, motion carries. Thank you. And next on the agenda is a community health worker program. Diane, again, thank you.
Here I am. Oh, here we go again. So we discussed this at the last board meeting as well, and we discussed it at the board meeting, and then we determined that there was going to be a need for a needs assessment to be sent out. And so, so the situation is that we, with care coordination being one of the biggest issues that our providers are really talking about right now and wanting to have, help with in this area. GCACH saw the need, and so we wanted to expand our activities with this area and provide an internship program to help our providers develop, have some community health workers to come in and help them with their care coordination needs. And then the background of this, that, community health workers have existed for a long time. In most of our federally qualified healthcare systems, they actually already employ, community health workers. And so what we're really looking for is through some of our, to include this with some of our primary care providers and maybe some of our behavioral health providers to provide this care coordination. If you go down further, Chelsea, go down to the assessment part, the analysis part. Yeah, thank you. But go back up. Sorry, right there. So this is just the preliminary feedback that we got from the providers, and on the assessment, we had 21 organizations respond, and it was actually it was pretty much equal between hospital, behavioral health, and the FQHCs, and we had one other facility. And so, can you go down a little bit further? So they really were, so those are the areas that provided the feedback to us, and primary care providers, hospitals, behavioral health, primary care, and then the FQHC. The organizations provided some information on what they're doing currently for their care coordination needs. They are usually relying on their social workers or care managers or clinical staff. They have some interdisciplinary teams with including clinicians, pharmacies, service coordinators, behavioral health staff. There were all kinds of things that they shared in that. In fact, I think there may be the whole list of the survey. If anybody's interested, we have combined it into one report. So if you're interested in seeing all the data, we could definitely give that to you. So some of them, the majority of the organizations responded that they had the desire to either start a program or add capacity to their current program. One spoke of the need to support specialists to increase health literacy. Another specified about helping with their health outcomes with specific minorities and vulnerable populations by connecting them with resources and addressing the social determinants of health. And then one of the questions was how would they integrate a community health worker into their practice? Most of them said that they would use interdisciplinary teams and also the integration into a health home program and other areas. The training, we asked about the training program. We had a good list of training from There was, I'm trying to think of motivational interviewing, the Camden model, the Washington community health workers training, the Washington navigator training, mental health first aid. And so all of these, most of them had selected pretty much all of them and felt that these were all areas that would be good to train a community health worker. And so after the assessment, we do see a need for community health workers. And we do recommend, so this is the recommendation that we're looking for from the board today. It's that GCACH board approved $850,000 to support a community health worker internship positions in its contracted primary care sites across the 9-county region. Position would be reimbursed as FTE, earnings approximately $16 per hour for a period of 1 year. The residual funds from the initial allocation and not paid towards intern positions would be used for acquiring training resources and undergoing a train the trainer activity for the GCACH program manager. That's a mouthful. Does anybody have questions about this program that we're wanting to implement?
So this is Rhonda. So this would be, you would send this out as an RFP similar to what you did the behavioral health internship program? I mean, would it be administered similar to the same way?
Yeah. So we plan on, we need to develop an application, and we would probably use the we would use the workforce committee as the scoring committee like we did for the last one. And we're going to handle it pretty much the same way. We will develop a policy and an application, and then the awards will be awarded after careful contemplation with the workforce committee.
Hey, this is Ronnie. Madeline, did you want to say something?
Oh, I was just asking if there was other questions. Thanks, Ronnie.
Yeah. So after this implementation and having this done for 1 year, what's the, how can we see this continue to be paid for through Medicaid dollars? Is that going to be able, is that even going to be able to happen with this program, or is this just going to be a one-time shot?
So we're hoping that that the organizations that we would be using this, the primary care sites that would be applying, would be able to show the cost savings that they were able to have and be able to continue to employ that community health worker for years to follow. But this, we would only be paying for the 1 year, to have this position available. As far as getting the community health worker paid for in other ways, that is not something that we can do as an ACH. That has to come down through policy and policy changes and such through HCA and worked out with the MCO.
Oh, Ann?
And so help me understand what you have in mind for metrics that would substantiate the success of the $850,000 investment. Like how many people were placed and how many people started and finished, hours of training. What kind of metrics do you have in place to substantiate the $850,000 when the year is up?
So that is something that we will develop with the workforce committee. some outcome measures that we will develop with the Workforce Committee once we have started the policy and the application for it. I was trying to pull up my chart. I think I do have some outcome measures already started, but yeah, that's definitely some things that we would have to do that we would need help with from our Workforce Committee.
Yeah, that's a really good question, Luann. And is it the expectation that a program manager will be hired to oversee this program, or will this fall within an existing role?
It will be underneath of me, as what I have understand. I will handle this program as well as the last one I just talked about, the campaign, and I have capacity to be able to manage this project as well.
So I wanted to answer part of Ronnie's question. This is Carol. The issue of paying for community health workers, as you know, Ronnie, has been the sticking point for Greater Columbia stepping into this. And we know, though, during COVID, there has been a great need and an increased need for community health workers across our 9-county region. I think the tipping point was the presentation from Becky Betts to the Workforce Committee. I think that was last month, who works for Providence St. Mary's in Walla Walla, and showed us the return on investment that their organization has received from their 2 community health workers that work with a nurse. It's a nurse community health worker dyad. And so they are so enthusiastic about this program that they're starting to implement community health workers across their Providence system, including next year they anticipate hiring community health workers for Cadillac. Given that attitude of some of our large healthcare systems, we're hoping that we can leverage their positive experience to advocate to the managed care organizations and especially to the healthcare authority that these services are in high demand. They add value to a healthcare team. We firmly believe that primary care is the driver of the best kind of care that you can get, and having that care coordinated through the provider along with the community health worker is a win-win. So we're hoping that with Providence's help, we can elevate the value of having community health workers on a team for team-based care, and it might get us a little bit further in terms of our advocacy for reimbursement.
To add a little bit to that, Carol, Becky informed us that government programs department through Providence, and by the way, Providence is one of the 10 biggest health systems in the entire country, is also doing advocacy, at least I believe, with commercial insurance carriers to try to get reimbursement for some of these positions. So we're banking a little bit, or hoping a little bit, that comes through as well. And so a concerted effort that does show cost savings might have some influence.
Thank you so much, you guys. This is really close to my heart. So
question. I just had a question regarding, will these need to be new positions, or could they be current positions that would then be reimbursed? Or have you decided that detail?
I definitely think the new positions. What do you think, Carol?
I think we'll have to take advice from our Workforce Committee. With the behavioral health internship, some of these behavioral health providers had people that they could intern. So I wouldn't say they were exactly new, but they were in line. They were looking for funding to be able to use them. In other cases, for the behavioral health internship program, I think we did pay the behavioral health providers for that internship, even though they had a program going. So I think we'll have to circle back with the Workforce Committee to answer that question.
Okay. Thank you.
So the MCOs had a couple questions. So apologies, some of these are mine, some of these are not my questions, but I'll kind of run through the list. On the getting to the 850,000, so understand that that's the cost of salaries for a certain number of CHWs. But so again, the question remains in the MCO's minds of sustainability past 1 year, which we know goes in the blink of an eye, and knowing the time it can take to get the reimbursement change, not only on our end, but on, the commercial side as well. So there are some concerns around sustainability, I think, from the MCO perspective. But on the number of CHWs, how would you, has there been thought put into how you would allocate them, knowing that some of the larger health systems already have CHWs? Is there a methodology around how you would, assign them? And then if you saw a huge influx of, say that it's well received in the provider community and you're thinking that, 25 is needed, but then the workload of 35 or 40 ramps up, what's the contingency plan in place? Is it just to say, we're time out, we're maxed out, or to kind of put providers in line in a queue? So kind of two questions. One, still anything else you can share around sustainability? There continues to be concern at the MCO level of sustainability. And then two, what is, and I have more after this, so I apologize, but on the dollars, sustainability, and then what's the plan for absorbing the workload?
So on the workload, I can talk about that one. So we're approximating about 24 to 25 positions. And then that would leave us some money for the training. And then we will develop a policy and an application, and that's how they would be chosen as and scored. So we would do a policy about what it is, what are the requirements, and then an application. And so they would fill that out, and then they would send it back in, and then it would be scored by the workforce committee. And then through that, we would choose the ones that scored the highest from their applications. That's exactly how we did we had a behavioral health internship program that we paid for precepting, and that or a position. So it was determined that was either or, but this is really going to be a salary for one FTE for a year. And so for us, we will handle it the same way that we handled our behavioral health internship. And that is why we put the dollar amount the same as what we used for the behavioral health internship. We thought that this could be comparable since we focused on the behavioral health providers last time. Then this time we're focusing on the primary care and utilizing community health workers to them. As for the sustainability, we hope that this makes a difference for them, and that's what we're, we will establish some outcome measures and such, but we hope that they're, the organizations will be able to absorb costs for the next few years to come.
Okay, so the sustainability is really dependent upon you paying for the first year, the ACH committing to paying the providers that $16 an hour, but then, level setting and managing expectations with the provider, then that they would be accountable for funding that FTE moving forward, or else the FTE would cease to exist. And then actually our next question, I saw someone actually ask in the chat, was we're budgeting $16 for a per hour salary, but then are we expecting these provider groups who have already been hit so hard this year and are furloughing and laying off staff themselves already to then absorb the cost of benefits and onboarding and training these these folks beyond the internship? Okay. All right.
Yes.
Okay. And then I think
It would be their application. I mean, they would know all of this before applying. It would be put into a policy with everything pretty explicit of what to expect from GCACH and what's to be expected from the provider that's applying for the funding. And so that will be developed, and that's how we will you know, explain it to the provider applying for it. They'll have everything up front. They'll know what they need to supply if we're going to supply before going into it.
Great. And then I think the last question that hasn't been addressed from the MCO side is, you know, at the end, we're aware of many organizations that are already doing the training and the marketing and the development of these CHWs, right? These larger health systems, and some of even the medium sized have them already. Are there differentiators that lead this group or lead you to believe that we will be a market differentiator, right? Like how would this program train a CHW any differently than a provider would? Or is this truly just earmarking dollars to increase the number of CHWs that are out in the market?
I think that we're increasing the capacity, and that is one of the things that's lacking right now. As for the training, we've heard from quite a few providers saying that they wish that their community health workers could be trained in this. And so those are kind of what we've heard from the providers, and that's why we did the needs assessment. You know, we have already been in contact with Washington State Department of Health, the trainer who does the community health worker training, and she would train the trainer for a few of our organizations. So it would be the exact same training that there already other CHWs are receiving. But then, you know, the provider probably, if they've already been doing this, they already have a way that they train their community health workers, most likely. But we could provide some motivational interviewing, mental health, first aid training, and in these areas to help with the training of those community health workers.
And you also
And then,
have to remember, I'm sorry. You
go
also
ahead.
have to remember that the Department of Health already has a CHW basic training with core competencies in mental health and healthcare. So that's always, that's the starting point. Everybody goes through DOH to get this basic training. If there's more training that needs to happen, that usually falls upon the provider shoulders, or the organization that's hiring to implement the other trainings. Because even as a peer specialist with Lords, I've had to go through their training, what they train for their people that do outreach and that are already working in their system for peers. So there's extra trainings that come along with that job for me.
Great. So then the last comment was, just the last comment from the MCO side was, there was thought on the folks from the MCOs that reviewed it and didn't know if this team had considered it as well, that maybe this makes more sense to be a part of the advanced transformation initiative connected with practice transformation. So didn't know if this had been reviewed at the practice transformation work group yet. I just not having my limited insight, right? I'll have more next year. But right now, having limited insight, didn't know if this had gone to practice transformation or if there had been a thought process around including it there.
So we could definitely take it to practice transformation, especially once we develop the policy. I think that, you know, we could get their input on it. This is just to right now we're just establishing it pretty much an earmark in our budget to be able to do this program.
And Kate, I would add that the Workforce Committee did review this whole concept at their last meeting and approved it as we have suggested it. I think it's a little bit of a chicken and an egg because we wanted to get this information in front of the board before we give you the district budget, which includes this amount for the community health worker program. So we wanted to give you enough information that you would feel comfortable seeing it in the budget. But you're right, we don't have all the details of the exact program put together yet. But once we get approval from the board to move forward with this program, you will be seeing probably the application and the full meal deal next month or in January, so that you can feel more comfortable about having addressed all of these details. In terms of reviewing it by the Practice Transformation Work Group, this kind of a program is not really in their charter. They are more accustomed to looking at data and seeing how the providers are meeting their outcome measures and quality metrics, and making sure that we have the right mix of providers in our cohorts. So that they probably wouldn't, the Practice Transformation Work Group probably would not see this, but certainly the Work Group Committee is the one that we would take this information to.
Okay, that's helpful. Thank you.
You're welcome.
Yeah, and Carol, you put it perfectly. It was a chicken and an egg for us too at the MCO level. When we reviewed it, it's like, do we feel comfortable approving it without having the details? But you can't really have some of the details until you earmark the dollars. So I think in full transparency, when we come to voting at this stage, the MCOs will probably vote against, moving it forward until more information is shared. But completely agree that, it's a chicken and an egg. So at this stage, though, I think the MCOs need more information to be supportive of it.
Okay, both your questions and my questions were really spot on. And I think the Workforce Committee will be taking all those questions into consideration as we develop the policy. And I'm really interested in developing kind of a full ongoing analysis about this project, and kind of thinking about how we integrate these questions into ongoing review process. And so, and that's why I asked that question about the manager who's going to be kind of supporting this project, because I think there's going to be a lot of work involved with this. Because I think those, being able to measure those deliverables over time and being able to report out on, there's going to be a lot of people interested in the outcome of this. Greater Columbia is kind of known for its innovation projects. And so like the behavioral health internship, and this will be another one that will get on the radar of a lot of people. And so your questions are great questions. If you want to participate in the detail work in the Workforce Committee, you're more than welcome to participate.
Hey, and I see in the chat, Martha had a question. Is there an expectation that these will be peers?
There's two different positions. There are peers, and then there's also the community health worker. So this will be the community health worker program, and the peers program is a separate program. The peers program is a completely separate program.
So this is Wes. Maybe I can add a little bit of an opinion here. In listening to what happened with St. Mary's and Walla Walla, the individuals that they hired for those positions, which by the way came through Greater Columbia Practice Transformation dollars, had lived experience in terms of sharing some of the same challenges that the people that they were serving had gone through. So that in itself may be a quasi-peer program. It may not be a formal peer program, but it may still have the essential elements of a peer program. If an organization decides to hire individuals in that sort of way or that sort of capacity, that's a potential option for them. I think that, if you look from organization to organization, these individuals fill different roles. So the organization that takes on the responsibility of an internship training program can delegate and assign what kind of work that they do.
This is Rhonda. I would just add that I think that for community health workers, the most important feature is that these are people that are from the community. Not necessarily that they're peers, but they're from the community, and they're really connectors to help people get the services that they need.
Thank you. Are there any other questions?
This is Dana. Can you hear me?
Yes.
Hi. So I was just wondering if there might be any consideration, because we know that also a year will fly by, and I don't know if there'd be any consideration around it potentially being an 18-month type of program with less. Can you hear me okay?
Yes.
Okay, sorry. With less, with fewer FTEs, just so that there's a potential of being able to see the deliverables that you want to get from it, to be able to have some good data behind it.
And so really the consideration is extending it from 1 year internship to an 18-month internship.
Correct. Correct. With fewer FTEs, and that may not, that may not make sense to do it that way. I just wanted to throw that out there if we're going to be looking at having some, metrics around it that we want to be able to track and gather, knowing that the first part of it is often taken up with that training component, which will eat into that year-long time.
Dana, I think that
I actually do think that makes sense. I lived an entire career on the provider side, working for a large health system, and I just know what they're living through right now with having to furlough and lay folks off, and then to get an application to have an FTE funded for a short 12 months. They just might be a little shy of that, knowing that, there's no guarantees on COVID in 2021, and their income sheets are not looking great. And so if there could be a commitment to support the FTEs, even if it's a smaller number of FTEs, for a longer period of time, that might lend to more sustainability.
I think that these are all good questions. With our behavioral health program, Kate, we try to across 9 counties. One of our that was a question that Martha Landman had, and she is the administrator for both Garfield and Columbia County Public Health Districts. So I appreciate that question. It's something, honestly, that I don't think that the workforce committee had considered, just because our behavioral health internship program was also a year, and we were just kind of trying to model, and this was pre-COVID, right? We're trying to model this program after something that we knew that had been tried and was successful. So I understand those provider concerns about sustainability. Again, we're not trying to implement a permanent program. So we'll just have to take that into consideration. But if we're talking about an 18-month internship, that drastically reduces the number of community health workers and would not provide a community health worker for every county that's in our region. So that's part of the difficulty of being a large ACH, is it just takes a little bit more funding to be able to have that equity across our 9-county region.
If there's, I was also going to suggest anyone that's really interested, as Dan was saying, they can participate in the workforce committee and provide some good examples or suggestions for this. So if anyone is interested in being able to be part of that committee, I'll just ask that you email, should it be Chelsea? That work?
That would work. Yeah, you could email Carol, and give us, just let us know that if you want to be part of, the details, as we say, that, because we're just earmarking the amount. We could even probably just take off the part that says positions would be reimbursed for a year. What if we just said, the first sentence as the recommendation? GCACH recommends the board approve $850 to support the community health worker internship positions in its contracted primary care sites across the 9-county region. And then we could take out the rest of it, and then those details could be hashed out from the workforce committee.
This is Rhonda. I would make that motion.
Thank you, Rhonda. A second?
This is Ronnie. I second that.
Thank you, Ronnie. Been moved and seconded. Any further discussion? Okay, hearing none. All those in favor signify by saying aye.
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 Those opposed, same sign.
Opposed.
Thank you. I too vote aye, so motion will carry. Thank you. And next on the agenda is the SBAR Business Plan Consultant, and Carol and Becky, you're going to provide us with the information on this.
Yeah, we're going to tag team this a little bit between the committee members. So on the business plan consulting work group was Loanne Ayers. Thank you, as our representative board member who did a tremendous amount of writing the RFP. So thank you so much, Loanne. She also participated in the interviews of the consultant. Becky, myself, Chelsea, and Lauren. So we formed the base of the committee that took this idea of hiring a business consultant to help lay out the next 2 years of activities for Greater Columbia ACH. Of course, this follows 2 years of annual retreats with our board of directors to determine what our core competencies were so that we could at least have some understanding of how to address this challenge of sustainability beyond the MTP. So we started really in 2019, and then we followed up with a second board retreat this August. The board eventually approved a motion coming out of that retreat to develop a business and financial plan for 2021. Again, we formed that committee, developed an RFP with a lot of assistance from Loanne. We had I think 4 proposals, and we interviewed the top 2, and the committee interviewed those and were unanimous in their choice of choosing Health Management Associates. Health Management Associates, as some of the board members might recall, enabled or helped Greater Columbia ACH in 2017 in developing and writing our certification and our project plans. So we feel comfortable with them, especially knowing that they have a lot of experience with healthcare systems and have helped other ACH-like organizations transition beyond the district program and the Medicaid waiver program. And with that, I'm going to allow my other committee members add any other information to this recommendation. So Loanne, did you want to mention anything?
No, it's exciting to get to this point and look forward to the work beginning once the contract is approved.
Becky, Chelsea, Lauren?
I don't have anything to add, Carol. It's been a fun experience, and I'm excited for that we get to move forward.
Hey, are there any questions? Do I have a motion supporting the recommendation?
This is Loanne. So moved.
Thank you, Loanne. Second?
I'll
This
second.
is Ronnie. I second.
Oh, sorry, Rhonda.
That's all right.
Okay, so it's been moved and seconded to authorize GCACH to contract with HMA in the amount of $53,200 $233 to develop a business and financial plan for 2021 and beyond, and the funding will come out of the professional services budget with a current balance of $99,324. Is there any further discussion? Okay, hearing none, all those in favor signify by saying aye.
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 And all those opposed, same sign. I too vote aye, motion carries. Thank you. And next on the agenda, I've lost mine, is the Yakima Masking Communications Campaign Round 2. Carol?
You know, it has my name on it, but I think, Lauren, you wrote this SFAR, so I would ask you to go ahead and present it.
Okay, I can do that. So we took the idea of the masking communications campaign to the board a couple of months ago, you know, as a result of the need to communicate to specific so that being said, you know, numbers are on the rise again. We were actually presenting to the communications committee at our meeting this month the outcomes of the Yakima Masking Communications campaign, which we will actually be doing later as well. And they actually had suggested that we go for a round 2. However, for this second round, we were thinking, you know, we already have the Spanish advertisements made up, so that's great. Just purchasing more media spots for that Spanish advertising, but also targeting the English-speaking population as well, specifically in Yakima County. So this is what this SBAR is really asking for. Chelsea, if you scroll down a little bit to the background. Thank you. So as I mentioned, you know, we brought this forward to the communications committee. We were talking about the metrics for the Yakima Masking Communications campaign. We had talked about a second round in Yakima for Spanish and English speaking advertisements, both in radio and television, as well as social media. As you can see in this graph on the, or this table on the screen, the duration of the campaign was September 14th through October 12th. And as you can see, you know, positive cases are increasing, or they were increasing. However, the rate at which they were increasing was decreasing. So that was the good news. We also showed, you know, that after the campaign, those rates actually started increasing again. And then in this next graph, you can see the spike in the COVID-19 cases were between May and July, and then started to drop off a bit in September, which is when our campaign actually ran, and are slowly starting to increase again, unfortunately. You can scroll down, please, Chelsea. So we thought this would be a great opportunity for us to start these advertisements again. You know, as I said, we have the Spanish advertisements already created. We just need to purchase media spots for those, and then creating those English advertisements both in radio and television, as well as advertising on Facebook as well. So if you scroll down a little bit, Chelsea, this is an outline of the 2020 Community Health Fund budget as it stands in 2020. We have about $156,000 left in the Community Health Fund, and we are asking to allocate $25,000 from the Community Health Fund for a round 2 masking communications campaign in Yakima for both Spanish and English populations.
And Loanne?
Yes, have you thought about replicating the campaign for Benton and Franklin counties because of our rapid increase during this holiday season?
Yeah, that's a great question, Loanne. And Carol and I think, have been kind of begging the Benton Franklin Health District to release these advertisements again in Benton and Franklin counties. As many of you know, we are working and contracted with Benton Franklin Health District to market the COVID-19 test site. We had asked, since cases are on the rise again, we wanted to release some of these advertisements as well from the Masking Communications campaign. However, they have asked us just to focus on the advertisements for the COVID-19 test site and not our advertisements for the masking campaign. So that's why we are just proposing for Yakima County.
So what do you think the chances are, I need your crystal ball, that they would allow both messages sometime between now and the next board meeting? Meaning if we were to authorize funds for Benton and Franklin counties, they would be in your back pocket when you get the release.
Maybe Carol can help me with this question, but we've probably asked them 3 or 4 times, and they have asked us not to advertise with these same advertisements that we released previously. So I would say that they would not want us to. Carol, would you agree?
I've been a bit of a nag, Loanne, about, whether or not we could go ahead and I even explained to Jason Zakaria, who's the administrator for the health department, that we were running these ads again in Yakima. I think, though, I saw just the other day a masking campaign that's being produced by Visit Tri-Cities. I noticed that. So I have a feeling that maybe they've already contracted with another organization to provide advertisements or marketing to wear a mask, because I did see one. But we have repeatedly asked and have been repeatedly quietly and respectfully turned down. So.
Well, thank you. I'm sad.
I know. Martha, I do think that they are generic enough to be broadcast across our 9-county region. One thing that we did hear, though, however, is for the masking campaign, people really like to see people that were of their own community, so that they really resonated with the fact that, it might be their mayor or their public health officer or somebody in their neighborhood that was actually on TV. That seemed to be a little bit more acceptable than having somebody from outside their community be in those advertisements. So even though I think that they're generic enough to run across all of the counties, our impression was that it was a little bit more impactful when we're using people from within the community.
And I have to say that I live in Yakima. I'm getting the Tri-City feed as well. And I'm guessing that Tri-Cities, you also see the Yakima advertisements. So there will probably be some natural pollination between the two. Okay. Any other questions or comments?
So Rhonda, do you know if they're, I think that they had done a recent survey for masking. In Yakima, do we know what the results there are?
The last, well, it's a little comparing apples to oranges, because we've started going to some different kinds of sites. So it's gone down a little, not significantly, but we're hovering at a little under 90% right now. But the last couple times we've been adding things like parks and bus depots, and so we're not just going to retail businesses like we have been. So so our rates are, I think this last one, I think it was like 85% if I remember right, where we were in the 95s, but we're also broadening our locations out somewhat, so it's not exactly apples to apples.
Thank you, that's informative.
And it might be helpful, Rhonda, for us to work with your group to understand where those locations are, so that when we have the opportunity to advertise or to shoot those advertisements, maybe we do them in those specific locations.
Oh yeah, the next time one comes out, I can probably print out the listing.
Okay.
Because we get a, when we sign up for it, we get it's not a Survey Monkey, but it's an online shot of all the different locations. And last time, Mike, I mean, he really extended or expanded the list through the valley. So, and there were some, I don't know, there's just a lot of just different kinds of sites. I tend to keep taking the bus depot because nobody else wants it. So the transit center, I should say. It's a very interesting place to be, but so I usually focus on that, but I'll try to remember to do that.
Yeah.
Good
And
for
if
you,
You can reach out to Mike too.
all right. Any other questions or comments? Okay, I will entertain a motion for the campaign allocating $25,000 for Yakima County campaign targeting all community members, both English and Spanish.
So moved. Loanne.
Thank you, Loanne.
Ronnie, second.
Thank you, Ronnie. It's been moved and seconded. Any further discussions? Hearing none, all those in favor signify by saying aye.
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 Those opposed, same sign. Okay, I too vote aye, motion carries. And I did Martha's question that them being generic enough. I think we had talked about the having the individual community members and the impact of that. So I think we've covered that one as well.
I think Martha's questions, any masking campaign would be better than none. So I guess maybe the board, we could bring it back to the board next month. I know we have a few more things on our agenda today, but if you would like for us to consider that, put together a proposal to see what it would cost to have a masking campaign across the remainder of the counties, we would be happy to do that. Is that what you were thinking, Martha?
I think that would be great. I'm
Okay.
Yeah, yes, that's what I'm thinking.
Okay. We'll do that.
Thank you, Martha. Okay, nominations for Yakima Valley Memorial Hospital and Molina representatives for the PTW.
So thank you, Madam Chair. As you know, the nominations for the Practice Transformation Work Group come through the Board of Directors. We have 2 vacancies. The vacancy for Yakima Memorial Hospital has been vacant for quite a while, over a year. And Jorge Rivera also left the Practice Transformation Work Group. And so we have 2 nominations to fulfill these positions. One is Misty Queen, who is from Molina. She's the Director of Healthcare Services for Eastern Washington. We included a copy of her bio and the nominating sponsor being Jorge Rivera and Victoria Evans. And then the other nomination is for Berta Lopez. We know Berta from her previous work with the Leadership Council on the Chronic Care team. Berta is the Director of Community Health and Health Equity for Yakima Valley Memorial Hospital. So we're excited to have her back in the fold, and those are the 2 nominations that we are presenting to you today.
Any questions or comments? So do I have a motion to approve the appointment of Bertha Lopez and Misty Queen?
I'll move.
Thank you, Les. It's been moved. A second?
A second, this Dan.
Dan, thank you. It's been moved and seconded. Is there any further discussion? Hearing none. All those in favor signify by saying aye.
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 Okay. Thank you. All those opposed, same sign. I too vote aye, motion carries. The next is the nomination for the Budget and Funds Flow committee chair and member. And Becky, are you going to provide an overview for us? And we're not hearing you, Becky. You looks like you're connected, but I'm afraid that we're not hearing you.
I bet you she's calling in.
Okay.
I don't see her on the list.
She was just on. I think that she must have dropped off and is going to come back on.
Okay. Give her a minute.
Well, while Becky's trying to log on, I think that again, this is the process that we use to replace board members or replace members on our committees. Budget and funds flow reviews, the district budget, they review the provider allocations. We have lost our chair, Ryan Lance, and so luckily, Rhonda Huff has stepped up to the plate to agree to be the board chair for this position. Becky, let me know when you can talk. I see that you're back on.
I am back. It kicked me out.
Oh my goodness. Okay.
Thank
So I got
you for
you
covering
started.
for me. Okay. So I heard you say that you announced Rhonda, and then did you say anything about our new member?
No.
Okay. So the second part of that is that at the last month's meeting, I asked for new members because we're a little low. We've lost a few people, as I think Carol mentioned. And so we got a nomination for Mitchell. I'm trying to find it. Rhodes, thank you. And he is from GCACH Hospital. He is their grant writer. And the Julie, I don't know if you want to say anything about Mitchell. I know you know him well.
Yep. So Mitchell is we call him the $1 million man. So I think it'd be great to have him on Funds Flow. And he works very closely up here with the LEN, with the Kittitas County Health Network. So I think he already comes with a certain amount of information and knowledge about the ACH. So it's a great guy to work with.
Thank you, Julie. And we did bring this nomination to the Finance Committee. And again, we didn't have a quorum, so we're just bringing it straight to the board for your approval of this nomination.
Right. So the motion would be to nominate for the committee chair, Rhonda Hoff, and for the committee member, Mitchell Rhodes.
That's correct.
So moved.
This is an approval, not a nomination, right?
It's an approval for the nomination. The Budget and Funds Flow Committee nominated these people, and the
All right.
Finance Committee approved it, and now the board approves it.
So the motion is to approve. I'm sorry, Ronnie, did you do that?
I thought
Julie
it was
did that.
Julie. Thank you, Les.
Okay, then I would second an approval.
Thank you. So it's been moved and seconded. Is there any further discussion? So hearing none, all those in favor signify by saying aye.
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 Those opposed, same sign. I too vote aye. Motion carries. Thank you.
I am proud to be your BFF.
Thanks, Rhonda.
So next up is the draft district budget for 2021. Carol and Becky.
So we'll have Chelsea bring that up. This is the first reading for both of these financial items. Just an overview of the district budget is that it continues the same philosophy of paying incentives to our providers as they reach milestones. The first year of the practice transformation program provides the most amount of incentives because we provide a population health management funding to purchase tools or add-ons to EHRs so that they can be successful in practice transformation. So we will be seeing these budgets go down over the course of the program because every year they get paid a little bit less, with the understanding that it takes about 3 years for any organization to feel comfortable with some of the practice transformation precepts. So can we put up the budget, please? In this document, you will see the budget broken out by cohorts. Again, we have 3 cohorts that started at different times. Cohort 1 actually started in 2019. Cohort 2 started in July of 2019, and cohort 3 started at the beginning of this year. So what we had to do with the math then, and what I did is I broke it out by milestones and the amount that could be achieved if all of the provider organizations achieved all the milestones. We know that that's not necessarily the case, but we are hoping that our providers are successful with all of these milestones. The use category is what is reported into the Washington Financial Executor Portal. So that only helps the internal staff understand when we get those payments where they need to go in that portal. The project engagement participation and implementation includes the milestones that you see below in that column D. So the quality improvement team, the PCMHA assessment, and the MEHAP assessments. Again, the milestone 8.1, which is the base population health funds, is only available in year 1. So that's not available in 2021. And then we've got the practice transformation membership, the CRC, the community resilience campaign, and board participation. We also pay incentives to those organizations, understanding that you guys provide a lot of free time for us, and it's just a very small recognition of the work that you're doing on our behalf. And then the second category under project engagement are those milestones, the budget, the clinical quality metrics, the roster reporting, and then completion of the PTI. Those 2 areas equal about 3.71 million. The next set of use categories, please, are dealing with fiscal stability through value-based payments. These are the milestones that are associated with that category. So there's risk stratification and opportunities for those at highest risk. I'm not going to read all of those, but again, these are all milestones that we pay our providers to achieve. The population health management and contract assessment, here we do have something other than just the incentives. For the first 4 columns are milestones that the providers are paid out. In column 32, however, you've got the HIE, HIT contracts that we pay for. We have a contract with Health Commons. The CSI Solutions is the portal that the providers report into. We have some funding set aside for direct messaging and a contract with Data Motion. We have a contract with Quadaim. Eastern Washington University is Patrick Jones. And then last year we actually funded out of this category funding for the Kennewick Fire Department. So that we're projecting will be about $300,000 for 2021. So that category equals about $3.457 million. We continue with our project incentives for milestones 2B, 6A1, and 8A1, implementation of PM and EDI. I don't know why that doesn't have any money in it. I'll have to ask Sam. And then the care coordination for clinics. So that totals up to 1.28 million. Well, if you recall, when we first started our program, all of the ACHs who had behavioral health organizations that were willing to integrate primary care and physical health billing mechanisms were awarded behavioral health integration funding, and that totaled for Greater Columbia ACH around $10 million. So we have been paying our behavioral health providers out of that behavioral health integration fund until it was depleted, which is at the end of this year. So we are moving all of those incentives under that category into the practice transformation and the disrupt. So it will just come out of the categories that I've already reviewed. But this is just our way of showing you that those integration incentives have now been incorporated into all of the practice transformation milestones. We do have some funding set aside for the Health Commons for Kittitas. Diane has come to you a couple of times in the past couple of months recommending continuance of our opioid resource networks. That scope of work will cost us around $250,000 in 2021. We will be continuing with our learning collaboratives, and so those totals amount to about $430,000. We are proposing that we have another round of community health funding. As you recall, in 2019, the board of directors authorized the $1.395 million to go out to the local health improvement networks, who chose a third-party administrator and determined what those social determinants of health the highest priority were in their communities. And we're proposing to refund that program, or to fund that program again in 2021 at the same level of funding. We're also proposing to implement a community paramedicine program. Again, the details have not been worked out similarly to the community health worker program, but we wanted to advance this to the board of directors for discussion and approval. So we can talk about it today, and we can talk about it again in December. We're proposing to fund again the local health improvement networks at $30,000 a piece in 2021. Having the community health worker internship program that we talked about earlier, and then we're trying to bring back this LIN Teams training, or some kind of a training that the LINs would be able to use, either in team building or to bring in a trainer. A couple of years ago, I think somebody brought in Ken Crabell, or they did some training around collective impact. So offering that up again. It wasn't very well utilized, but we're hoping that in 2021, people are reinvigorated to access this fund. We've got the Community Resilience Campaign, the Cope Calm Care program that Diane talked about at $500,000. Our contingency budget at $696,690. And then investment into the Yakima Nation for their community health aid program, which we heard about last February, and they were requesting $200,000 to get that program off the ground at Heritage University. So that brings our total amount of budget, drum roll. Oh, and here's the staff cost to implement all of these great programs. So having our navigator positions, our administrative positions, and then including a grant writer. We heard yesterday that we might not have allocated enough for our grant writer, but that takes the total district budget to about $15.42 million.
So are there any questions or comments? And at this time, this is just information, correct, Carol?
Yes, it's just kind of a first reading and to let you guys dwell on some of these numbers and come back with us. We can answer questions.
Great.
But I see that Chelsea doesn't have audio, but Luann has a question.
So you've noted several changes that have come up since reviewing this with Finance Committee. When might we see the next rev?
Next month at the December meeting, and that would be the final reading. And I think the big changes, Luann, might be in the grant writer position. We were told that that was probably a little low for a full-time grant writer. And then I think we need to do a little bit more homework on the community paramedicine program.
Thank you.
Are there any other comments or questions? All right. So next up is the draft operations budget.
I'm going to let Becky take that one.
Okay. So on this is our the first read of the operations budget for 2021. And what we did is we in column B, you can see that the budget that was approved by the board for 2020. And then column C shows the actuals that we spent for each of those line items from the 2020 budget. And then E and F, the highlighted blue, is the proposed budget for 2021 as well as our notes. As you can imagine, we go through this budget many, many times, and most of the time, either Carol or I will say, "Well, why did we do that?" Well, I don't remember. So we include a little notes column so that we help ourselves stay on track as we go through this and have our various iterations of this budget. There have been many, many, many. So this is the latest, and we put our revenues on here just to show you guys where our money is coming from that goes into our America money market account. Most of it comes from district. As you can see, our salaries on there from was $625 for the actuals, and we put all of our deposits go into our money market account, and then we draw down that money into our checking account as we need it for expenses through the month. And we normally draw down about $50,000 a month. So that's what those first lines are showing you. And then there's some other revenues in there that we have that will be showing up for next year, including some grants that we have. The masking campaign is all done, but we're bringing over some of those leftovers that I'm looking for. Oh, scroll down. Sorry, I was looking for something that wasn't listed yet. Can you scroll down, please, Chelsea?
Becky,
there we go.
Ronnie has a question.
Oh, yeah. Go ahead, Ronnie. Sorry.
I just want to find out if you guys, because I'm looking here and trying to figure it out, and I'm not a numbers person, but I am a human being person. And did you guys put in a percentage for raise because you guys have been working all this? Just wondering if you've budgeted for a percentage of a raise for each of you that are working.
It is included.
Okay, I just want to make sure that we're taking care of you people. I say you people. I want to make sure you guys are okay, because you guys do a whole lot of work, and I care about every one of you guys.
Thank you.
Thank you, Ronnie. Yes, we did. Okay, so back to the revenues. What I was trying to look at, and now I see it up there on the screen, as you can see, we have some money that is going to be coming in from the Rural Health Collaborative grant that we have for 2021 is going to be about $61,000. We've received 13 already from them in 2020, And then we have our Benton Franklin Health District contract that we have for marketing the test site is going to be bringing in some money for 2021. And then we put $30,000 in the interest line, which probably is low. As you can see, we have almost 65,000 that we earned for 2020. So we were being a little conservative there. So our total revenues budgeted for 2021 is just over $2.2 million, which is more than last year. Yay. So if we can get on down to the expenses, Chelsea. So our actuals for 2020, as you can see, and we already went over a little bit in the financials, is significantly less than what we had budgeted. But I think we've talked about the reasons, and I think we all know the reasons. No traveling, no events, no fun stuff that we like to do here at GCACH. We really love doing all of our events and seeing everybody's faces, and we didn't get a chance to do that this year. But we kept the budgets for those items. You can see the community events sponsorships. We kept that at $30,000. I'm hoping that we'll be able to do more of those this year. And then our cars, so the next line 32 is our car leases. So our cars, as you guys remember, we leased 2 cars, and the leases are up next year. And so we are proposing to buy out the lease so that we can actually own those 2 vehicles. And that's $21,000 that's left on that. And then for our payroll expenses, you can see, Ronnie, our payroll expenses have gone up for 2021.
Good, but I want to know if you guys are putting in the budget for maintenance for the vehicles. If we're buying out those vehicles, there's got to be somewhere in there budgeted for maintenance of those vehicles.
That's a good point, Ronnie. We do not have anything budgeted for them, for the vehicles. Currently, the way that we did it is when we purchased the lease on the vehicles, we also purchased a maintenance plan. So that's how they've been being paid for. We paid that out in advance. So thank you. That's a good point. We'll add that in there. I see Carol taking notes. Loanne, you have a question as well?
Sure. Help me understand the cost drivers for the 35% increase in payroll expenses.
Sure. So some of that is rates for the staff, as Ronnie asked for, and then we're also anticipating doing possibly hiring next year. We talked about hiring for a grant writer, and then we're also considering one other, possibly another navigator.
And so how many FTE additional would that be?
2.
It would be 2. The grant writer and the navigator.
Great. And then on professional services, is the reason that you're 33% more this year than last year because you so underspent and it's delayed?
Carol.
Yes.
Carol, do you want to talk about that? Yeah.
Yes. I think that we were anticipating maybe getting an earlier start on the business consultant, Loanne. I think that we were a little bit ambitious around that. And then moving forward, we know that we need to get some more help in businesses, so that would help as a and then maybe, Becky, this would be a good time to announce your new plans. And so we have to plan for the departure of Becky. So we were going to wait to make that announcement, but maybe now's a good time to do that.
Okay. Yes. So Becky is leaving GCACH. Next week is my last week. I'm moving on. So yes, part of that will probably be leaning a little heavier on the lawyer for the contract, since I won't be here until they can get somebody new in.
Sorry to hear that.
Thanks, Madeline.
I wish you well.
Did I answer your question?
I wish you were here with us because you've always kept us on time and on target.
And if you could tell me more about the office remodel?
Oh, sure. Did we get there yet? No. Office remodel, $30,000. Yes. So since we love our new office, as you guys know, we were so excited to move in here. have this space and be in a better location where we can better serve all of you and have you all in our office in a non-COVID world. But since we've been here, we've realized that the space down at the end of the hall where all of the cubicles are, which if you've been here, you've seen, I know Ronnie, you've been in here and seen that, that cubicle space is really open, and the navigators have been in the office a few weeks ago before we got shut down again. A lot of us were in the office again, and we noticed that because they're not traveling to their sites, they're on the phone all the time. And so we had 3 or 4 people in those cubicles that were constantly on the phone. And so everybody was, I mean, when one of them's in a meeting and like I'm in my office in the same meeting, I can hear the other person next to them in the background talking on their different meeting. And so it just kind of came to our attention that maybe we need some better space over there. So we've contacted Bella's, who did our original layout in this office, and they've sketched out some plans for us. And then that $30,000 really, though, is we're considering actually building offices over there. So everybody, all the people, the navigators that are on the phone all the time would have their own office with the actual door and walls. So to try to keep the noise down, and then also to try and protect everybody when we do come back into the office, giving everybody some more privacy in their own space, hoping that we won't be spreading COVID when we all come back. So it's kind of a 2-part.
And were you able to get estimates? Because adding real walls changes HVAC.
Yes, we know. We haven't gotten any real estimates yet, Loanne, but yeah, I appreciate that comment. We have thought about the HVAC, and that really is probably will be the biggest problem in here. I know it all runs through the ceiling. So I think it's just a matter of venting it out if we actually had because they're just tiles in the ceiling. So I think it's definitely doable. And then also, of course, talking to our landlord. This is just real preliminary so far. We've had a few conversations, but no hard bids or anything yet.
Okay. Great questions, Loanne.
Yes.
I'm a numbers nerd.
Yeah. No, we appreciate it. You know, we see this, we are in this all the time, and we're in this little bubble of the budget. So it's good I appreciate your guys' questions. Any more questions on that section before we roll on down? Get into the operations expenses.
And just so that we know, Chelsea noted that we only have a few minutes left. So I hope everybody can hang in there.
Okay, I'll go fast. So the next section is just our operations, just everything that we need to stay afloat for our technology, our printing, copying, office supplies. So everything, does anybody have any questions about that? We kind of tried to keep it the same. We lowered some things. We lowered our technology because last year that was really high because we bought some new laptops for staff, and so we don't need that this year. We only have, I think everybody has new laptops now, so we're not anticipating any great need, just outfitting the new staff if we decide to do some hiring next year. Any questions on that section? Okay. This last part talks about our staff training, which all of the staff really enjoyed that. I know I have really taken advantage of that program. We do a lot of training for our staff. I got a certificate from Cornell University online last year. I really enjoyed that we offer that to our staff. That professional development is really important. So we're keeping that on for $35,000. And then travel, hopefully we get to actually have some travel. We did lower it a little bit because I don't anticipate, at least first quarter of next year, that we'll still be doing much traveling, but so we lowered that a little bit. The last section is all of our designated funds, which you guys are familiar with seeing these on the financials. And the big one that is going to be rolling over into 2021 is the Learning Collaborative. And we're not adding any money to it. It's still being carried over. And actually, it's been money that's been carried over since 2019, and we haven't utilized it. So hopefully we'll get to do some of that next year. So our total budget for 2021 is almost $2.1 million. which is a little less than last year's budget and way less than what we actually spent last year. So we've got the money and hopefully we'll get to spend it next year.
All right. Any other questions or comments on this? All right. Well, thank you. And we'll look forward to seeing this again on the December agenda for approval. And I'm going to go ahead and just, Carol, if you want to talk about the nominating committee.
So Chelsea, why don't you go ahead and take this one? Oh, she can't. She doesn't have audio. I'm sorry. So we have several positions that are coming up in 2020 that needed to be renewed, but fortunately, we contacted those positions that were coming open and everybody has agreed to continue on the board of directors. So there's actually no need for a nominating committee this year, which is very exciting. So thank you all for continuing your service.
Great. Well, thank you. So then I will have you pull up the Yakima masking communications campaign metrics that we were kind of touching on. And since Chelsea doesn't have audio, is there someone else that can lead this?
Yeah,
Lauren?
I can cover this, Madeline. And
Thank
I'll go through this really quick because I know we're at time. But this is also included in your guys' packet as well if you want to take a closer look at it. And if you have any questions, please feel free to let me know. But we wanted to share the outcomes and the measures for the Yakima Masking Communications campaign. So this is just a little bit of an overview. The campaign was held September 14th through October 12th, 2020 in Yakima, and we advertised on television, radio, and Facebook. Next slide, please, Chelsea. So this slide just outlines our advertising efforts for the 5-week period. So Win 211 received a total of 66 calls just in Yakima, just for their COVID-19 line, for an average of about 13 callers per week. We posted on social media 14 times. We purchased 292 television spots and 158 radio spots over the 5-week period. This slide just outlines the COVID-19 numbers. So as of October 12th, 2020, there were just over 11,500 COVID-19 positive cases in Yakima County, which were 71 more cases than the previous week and 29 cases less than the previous. I'm not sure, that number might not be correct. Anyways, 71 more cases than the previous week. Next slide, please, Chelsea. So this just really outlines the positive cases over the course of the campaign. So as you can see, cases were increasing. However, the rate at which they were increasing were decreasing, with the exception of those couple of weeks we included after the campaign. So that's the good news. We're excited to, continue this effort in the future as well. Next slide, please, Chelsea. And then these tables just outline the hospitalization and death rates in Yakima County. So for the most part, same situation for the positive cases. So while the cases were increasing, the hospitalization rates and the death rates were increasing. For the most part, the rate at which they're increasing was decreasing. And then this slide really quickly just outlines our budget. We spent about $3,500 to create the radio and television spots. We used Spotted Fox Digital. We spent $2,700 on television ads, $270 on Facebook advertisements, $2,500 on Spanish radio spots, and then we purchased gas cards for the individuals that we interviewed, and so we spent about $315 on that, for a total for the entire campaign of $9,348. So for Benton Franklin and the Yakima Mass Teen Communications Campaign, we spent about $26,000 total, which is great. You know, our budget was $25,000, and then we received $5,000 from Tri-Cities Community Health. So we had a total of $30,000 to spend on these efforts. So overall, it was a success, and we're again excited to continue these efforts.
Thank you so much, Lauren. All right. Any questions or comments? All right. Well, I want to thank everyone. Just a reminder, the next time will be in December. I can't believe that we're going to be in December. So wishing everyone a very thankful Thanksgiving, thankful for being safe, and hopefully being able to get through the rest of this year and staying close, whether it's virtually or otherwise, with family and friends. So thank you everyone for participating and making a difference in our communities. So thank you all, and we'll look forward to seeing you in December.
Thank you, Madeline.
Madeline, thank you for stepping in today. I appreciate your big face there and smiling and carrying us through this.
Thank you. Bye-bye.